Walking into a clinic to have someone tell you about a fundamental part of yourself, your hearing, can make you feel incredibly vulnerable. But you know what's worse? Walking out of that same clinic feeling even more confused than when you went in. You leave with a pamphlet, some vague diagnosis, and the sinking feeling that you weren't truly heard. That happens way too often, and we're going to change that today. Because that first appointment isn't just about a test, it's the moment you start to take control of your hearing journey. And honestly, being unprepared is the biggest mistake you can make. It can lead to confusion, frustration, and a treatment plan that just doesn't fit your life. We're going to give you the tools to make sure that never happens. This isn't about doubting hearing care professionals. It's about turning you into an empowered patient, an active partner in your own healthcare. The goal is to shift from being a passive listener to the person leading the conversation. Your hearing care provider is the expert on hearing science, but you are the world's leading expert on your life, and that's the most important piece of information in the room. Hi, I'm Dr. Layne Garrett, founder of Timpanogos Hearing Tinnitus, where we've helped thousands of patients live better, more connected lives through treating their hearing loss and tinnitus over the last 23 years. Before we dive in, hit that subscribe button because this channel is all about helping you take charge of your hearing healthcare with clear, honest, and expert guidance. And let us know in the comments, what's the one question you've always wanted to ask an audiologist but never knew how to say it? The real work starts before you even set foot in the clinic. Showing up prepared can completely change the outcome of your visit. It's not just about filling out paperwork, it's about building a case file for your hearing. First, become a hearing detective. For a week before your appointment, carry a small notebook or use the Notes app on your phone. Every single time you struggle to hear, write it down. Was it a noisy restaurant when your family was telling stories? Was it trying to understand a soft-spoken person on the phone? Or maybe during a work meeting, making you feel a step behind? Get specific. I can't hear the TV is a good start, but I can't hear loud action scenes because I missed the dialogue and have to turn on subtitles is a goldmine of information for your audiologist. This diary gives your hearing loss context, which is more valuable than any single test. It tells the story of how your hearing loss actually impacts your life. Second, gather your records. Make a complete list of your medications, both prescription and over-the-counter. Some medications can actually affect your hearing, so this is important. Also, jot down any relevant medical history, especially conditions like diabetes and high blood pressure, which can be linked to hearing health. And don't forget about your family's hearing history. Did your parents or grandparents wear hearing aids? This helps the audiologist understand if there's a genetic link. Third, and maybe the most important step of your preparation, bring a wingman. Ask a trusted friend or family member to come with you. An appointment like this can be emotional and packed with information, so having a second set of ears is invaluable. They can help you remember things, take notes, and just be there for support. Plus, they might have noticed things about your hearing that you haven't yet. Okay, now you're in the room. It's time to open that notebook up and start a conversation with your hearing care provider. This is not an interrogation, it's a team effort. To make it simple, let's break it down into 4 key pillars. The first pillar, understand that diagnosis. After the tests are done, the hearing care provider will discuss the results and explain how they apply to what you are struggling to hear. This is your first real chance to engage. Don't just nod. Ask questions like, what kind of hearing loss do I have? Hearing loss isn't a one-size-fits-all thing. It can be conductive, sensorineural, or mixed, and knowing the type helps identify the cause and the right treatment. Second, ask them, how severe is my hearing loss? Is it mild, moderate, severe, profound? This helps set realistic expectations for what treatment really can do for you. And also ask questions like, what do you think caused my hearing loss? Was it noise exposure from a job, normal aging process, a medical condition, or something else? Understanding the cause can sometimes help prevent it from getting worse. The second pillar is connecting the diagnosis to your life. This is where your detective work pays off. The diagnosis from the tests only matters if it helps you solve real-world problems you've been writing down. Ask questions to the hearing care provider to make sure you understand the results and how they apply to that hearing loss. Say something like, I really have a hard time hearing in crowded restaurants. Based on these results, why is that? This makes the conversation practical and personal. Ask things like, are there any communication strategies I can start using right now to help in those situations? A hearing care provider can give you free tips like how to position yourself in a room or use visual cues. You may want to ask, is my work or hobby environment a factor, and what can I do to protect my hearing that I have left? This shows that you're thinking about long-term hearing health. Pillar number 3, explore all of your options. A lot of people think that a hearing test automatically means hearing aids, but a good hearing care provider will talk about a whole range of options. You need to make sure you're not being just pushed into one single solution. Ask, what are all my hearing treatment options? This could include hearing aids, but also things like assistive listening devices, cochlear implants, or even sometimes medical or surgical treatments depending on the cause of the hearing problem. If hearing aids are on the table, get more specific. Based on my hearing loss and my lifestyle, what type of hearing aid is best for me and why? There are tons of different styles of hearing aids, from behind the ear, invisible, to the teeny tiny ones that go in deep inside your ear canal, and they all have pros and cons. And ask about realistic expectations, something like, how well should I expect to hear in quiet places? And what about in places like crowds and restaurants? Here's a powerful question. If I were your family member with these exact results and this lifestyle, what would you recommend? This often cuts through the clinical jargon and gets you a more personal, honest answer. And ask about the adjustment period. It takes time for your brain to get used to hearing sounds it's been missing for a long time. So how does the treatment plan that the hearing care provider is recommending help you through that adjustment period? The 4th pillar, the practical stuff. The last pillar is all about the long haul. This appointment is not the end of the road. It's the start of a relationship with your hearing care provider. Ask, what are the ongoing costs I can expect? Things like batteries, regular servicing, or any potential repairs. You can also ask questions like, what does follow-up care look like? How often will I need to see you for adjustments? Do you follow best practices like verifying the prescription in the hearing aids using real ear measurements? What's the trial period for the hearing aids? And what's the return policy if they just don't work out for me? And finally, can you show me how to properly clean and maintain my hearing aids? Because good care is key to making sure your investment lasts. While you're having this conversation, pay attention to the vibe. You're not just getting a diagnosis, you're potentially picking a long-term partner for your hearing journey. A green flag is an audiologist who really listens. They ask about your life and your goals, they explain things clearly without a lot of jargon, and they welcome your questions. You feel like you're part of a decision-making process. That's patient-centered care. A red flag, on the other hand, is a provider who seems to dismiss your personal experiences. Maybe they seem rushed or annoyed by your questions. Be cautious if they push just one specific hearing aid without a clear reason, or if they just rely on factory settings without customizing it for you, or try to tell you that real ear measurement verifications aren't needed. If you feel unheard or pressured, it's 100% okay to go get a second opinion somewhere else. Your hearing is precious. It connects you to your work, your passions, and the people you love. Walking into that first appointment unprepared is like setting out on a road trip without a map. But by doing your homework and asking these questions, you're not just getting the map, you're getting into the driver's seat. So take these tips, write down your questions, and book that appointment with confidence. Want to go deeper? Get a free copy of my book, Hear Us Out, at freehearingbook.com, packed with advice just like this to help you become the CEO of your own hearing health. Remember, the point of this visit isn't just to find out if you have a hearing loss. It's to find a partner who will listen, respect your experience, and work with you to find solutions that fit your life. It's about starting a journey that leads not just to better hearing, but to a better quality of life. You have the power to make that happen. Go in prepared, be your own advocate, and take charge of the conversation. Your hearing is worth it.